Hey VCE HHD students, my name's Andy, I'm a VCE Health and Human Development teacher. In this short video we're going to look at answering the 2021 VCE HHD exam, question number 11. Before we dive into question number 11, just a reminder that the Health Resources Hub YouTube channel, a new video like this one is coming out each day between now and the HHD exam this year. You can subscribe with the button in the bottom corner of the video there. Please let your HHD friends know they can do so too. You can see our social media links there if you'd like to follow us and get alerts on new videos coming out each day, and also our email if you have any questions or suggestions of videos you'd like me to work on. You can see here question 11 from the 2021 exams with 8 marks, and it started with this infographic here that said 1 in 4 healthcare facilities lacks basic water services. This exposes 1.8 billion people to greater risk of infections. It says 1 in 3 lacks hand hygiene facilities where care is given, 1 in 3 does not segregate waste safely, and 1 in 10 has no sanitation services. So you can see that that was by the WHO and UNICEF, so the United Nations Children's Fund. So then A for 4 marks was asking you to identify and describe the WHO priority represented in the information above. So there's 3 different WHO priorities, and you could have chosen any of those because they are all relevant to the information above. And then you had to provide a description that was worth 3 marks, but you didn't actually have to link it to the information there. So you've got to make sure you look at the question carefully, because it was just asking for you to identify and then describe that WHO priority in the depth that would be required for 3 marks. And you can see this was a difficult question with only 2% of the state achieving 4 marks. A reminder, those 3 WHO priorities are achieve universal health coverage, address health emergencies, and promote healthier populations. And you can see that they gave a high scoring response for promoting healthier populations. The description says that this priority is about 1 billion more people experiencing better health and well-being. This priority direct mainly towards SDG 3, good health and well-being, and attempts to reduce rates of maternal mortality, infant as 1 to under 5 mortality, and it also aims to end epidemics and reduce the impacts of communicable and non-communicable diseases. So unfortunately this is kind of indicating that you should know a pretty detailed description of each of those WHO priorities in case a question like this does come up again on the exam this year. B was then worth 4 marks, and it asked you to explain how a lack of basic water services in healthcare facilities could have an impact on human development. So remember, whenever there's a question on human development, you're being asked to link to those different phrases from the human development definition, such as decent standard of living, access to knowledge, develop to their full potential. And so here you had to make sure that you were linking a lack of water services in healthcare facilities, not just generally a lack of water. Okay, so make sure if you, once again, get a question like this, that you're reading it really carefully and you're linking it in, okay, to the specific aspect of the question, which was water in healthcare facilities. So you can see then, once again, this was a difficult question for students with only 16% of the state achieving either 3 or 4 marks. And so you can see they gave a high scoring response, which talked about a lack of basic water services in healthcare facilities means that more people are exposed to the risk of infections and susceptibility to disease, especially those that are waterborne, such as cholera and diarrhea. That means more adults have to live with ongoing infections and diseases, then they cannot return to work. And that means people are not able to earn an income to afford basic needs such as food, shelter, clothing, preventing them from a decent standard of living. So that's a link to the human development definition there. A lack of basic water services in healthcare facilities means that more children are being displaced from their parents due to them being ill and having diseases that are prolonged. That means children can't attend school in the absence of their parents with the money to do so, and that children can't be educated and their choices and capabilities are not being enhanced, okay, for their future benefits. So a couple more links there to that human development definition. So I would always, include at least 2 to 3 human development phrases if a question was worth 4 marks there, as well as obviously making direct or meaningful links to any stimulus material that's provided. Okay, hopefully you found that useful. Just a reminder, the Health Resource YouTube channel, our social media links, and our email. Thanks so much.